To begin, let us acknowledge that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. We are grateful to be able to live, learn, and play on these lands. We thank the Indigenous peoples of this area for the care of their land for thousands of years, and we hope to honor and respect them as we hold our virtual event today. I'd also like to take a moment to personally thank everyone for attending our virtual presentation today. Our speaker this afternoon is Dr. Jade Savage, who will be presenting on behalf of the research team on the topic 5 years of eTick data, highlights and outlook. Dr. Savage is a full professor at Bishop's University, where she's been teaching and conducting research in the field of entomology since 2004. An important part of her research program is dedicated to the development and dissemination of arthropod identification tools accessible to non-experts, especially for groups of medical or agricultural relevance. She is also the instigator of eTick.ca, a citizen science tick monitoring tool and information dissemination platform in Canada. We will have Dr. Savage present, and then we will open up for questions from the audience. You can ask your questions by entering them into the chat box, or you can raise your hand icon using the hand icon provided. Please help us welcome Dr. Savage to the podium.
Hi. Is it okay for me to share my slideshow now?
Absolutely.
Oh, okay. How's that?
Perfect. All good to go.
Okay. Hi, everyone. So I'm sad I'm not reaching as many people as Nick from yesterday, but thank you all very much for showing up. So today I've decided to tailor this presentation to a very mixed audience. So I apologize if some of you have seen some or part of this. And also, if some of you feel that I'm not providing enough information about the actual platform, don't hesitate to ask for details at the end. It will be a pleasure to answer. So just to get started, I think some of you already know that eTick is actually a public web platform. And I'll give you a little bit of background on the history of the project after, but essentially this is a tool that was developed to provide members of the public with a quick identification product, and also information that would be tailored to the species that they found, but more specifically to their province of residence. So even if we know what species was found on us, our pets, or our family, often we may not really be able to figure out what should I do. And health being administered at the provincial level, it's important to get the information that is relevant to you at the moment that you most need it. So the messages that we disseminate are always developed in collaboration with the provincial health authorities, and they are updated or modified as information changes and the needs evolve. So that's something I wanted to mention getting into that. So it's very simple. The way it works is that people just have to take a picture, upload the picture onto the eTick platform or using the mobile app, and then answer a few questions. And once that is completed, a member of my team gets a notification. They look at the image, they check out that the rest of the data is good, and then identify the submission. The user will automatically get the information that I just mentioned, and at the same time, a dot will appear in real time on the interactive map that is public and visible to anybody that wants to look at them. So the data found on eTick, each entry that is valid can be looked at. So you can see the picture, where the tick was found, what time of the year, and what year it was collected. So all of that information can be browsed and looked into directly on the eTick website. So the project did not develop overnight. This is something I just realized that we've been working on this for almost a decade now. This is an idea that began in 2014, and then with some colleagues from the agency as well as from the Laboratoire de Santé Publique du Québec, we developed a pilot idea. You have to keep in mind, a decade ago, the idea of using pictures to identify tick wasn't considered that easy. Cell phones were not where they are today, but we gave it a shot, and technology was on my side because quickly it became obvious that we could do it. We proposed a project to the Infectious Disease and Climate Change Fund from the Public Health Agency of Canada in 2017. It got funded in 2018. And since then, we've been expanding both the content and the geographical scope of the platform. So this is something that began in Quebec only, but rapidly expanded beyond that one province. So 2019, we added Ontario and New Brunswick. Then things went pretty smooth, and they ran so well, we decided then to continue and expand beyond these three provinces. 2020 was the year we launched the mobile app. Now, this was quite a game changer. I'll talk about it a bit later on, but definitely the mobile apps have really made it easier for people to use the eTick services. 2021 is the year where we had coast-to-coast coverage, so I was very happy. It was also a really high tick year, especially out east, and we'll look into that a little bit. Last year, we managed to add in the 2 territories, and because now we have a data set that is beginning to be a little bit more mature, we actually had the possibility of sending surveys to our users, and also now that we're getting an interesting data set, we're starting to establish new collaborations, some of which I will discuss today. 2023, well, we're still just in the early days, even though the tick season is really onto a good start. We are in discussion with Nunavut, so this is the last territory to add in. So I'm hopeful that they will be added as the end of this year. We've created a new Atlantic hub that will be based at Acadia University, taking care of the Atlantic provinces. So this was new from this year. And we're also starting to develop some AI tools that are specifically tailored for the eTick platform. And I will talk a little bit more about these today. So just very quickly, I wanted to give you an idea of what kind of data we get. And you can see here that things are sort of ramped up rapidly starting in 2020. So the first few years, things were a bit more modest. We've been adding provinces, especially in the early days. As of April 30th, we had over 37,000 submissions. And I checked just a half hour ago, and we are now up at 38,455 submissions. So things are going quickly, and we can actually monitor all of this in real time, as I was mentioning. One thing that is worth mentioning, when people look at the data on eTick, what they see are the valid submissions. A valid submission is one that is considered of high enough quality to be shown on the map, but also a submission where we are sure the tick comes from Canada. Doesn't mean it's endemic, but it was acquired from Canada. So often we get submissions from outside or from returning travelers. These do not appear. They're considered invalid, along with pictures of beetles and spiders and raisins, along with other incomplete submissions. So there is quite a good volume of submissions to be processed, and those you see represent about 75% of all submissions. So who contributes? Ontario bears the brunt of submission numbers. So I really want to take the time to thank the Ontario team. So Manisha Kulkarni, as well as Katie Clow and Claire Jardine have been managing the teams that are identifying the ticks from Ontario. And you can see that they are busy, very busy, especially in 2021. The red bar here, that was a very high year for Ontario and Nova Scotia. So definitely important. Just behind Ontario, we get Nova Scotia, and then Saskatchewan and Quebec coming fairly close behind. So obviously the number of submissions vary quite a lot by province. So what do we get? Well, we get a lot of dermacentaurs. And here, some of you are probably wondering how we managed to separate the 3 Canadian species of dermacentaurs. And the answer is that we don't. So obviously, when we receive the specimens, we can look at the spirochelar plates, and then that's easy. However, based on images, and remember, eTick is a image-based platform, we can't separate these species, so we group them together. And this is why they're treated as dermacenter SPA, because based on images, we can't separate them. Of course, based on the specimens that we've received, because we do ask for them, we know that the vast majority out east is variabilis. Out west, Andersoni, but also quite a lot of variabilis. But again, for the purpose of being accurate as much as we can from the perspective of the platform, we are providing a general group for dermacenter, and we are providing in our messages information about all the possible species found in each province. So lots of dermacentors, then a lot of black-legged tick, of course, Ixodes scapularis, and we'll talk a little bit more about these. But what I want to take time, well, again, I really want to emphasize the fact that each province really has a unique profile. And in other presentations, I did go through differences between provinces. I don't really have time to do that today. However, if you have specific questions about a province or anything, then don't hesitate to ask. But I really want to emphasize that we can't extrapolate what happens from one province to even the adjacent provinces. Every province really has a unique profile in terms of composition, relative abundance of the species, and even the phenology for the same species. So really, it's important to be able to have a province-specific view, which is something we can do with the eTick data. Now, I want to talk a little bit about this extra 4%. So as I've said, we have a very high volume of dermacentor, lots of Ixodes scapularis, but what's the rest? So the remaining 4%, well, we have a lot of different species. So we've reached 18 species this year, and these other species, that category is dominated primarily by Ixodes cookii, the groundhog tick, and then Ixodes pacificus, obviously, since BC joined 2 years ago. I'm expecting that proportion of Ixodes pacificus to increase in years to come. But for now, it is still sort of part of the other species. Here, I just want to highlight a few things that tend to be of importance, or at least groups for which I often get questions. So the Lone Star tick, we do get some Lone Stars, of course. We've only gotten about 76 valid records plus a handful of non-valid records over the years, primarily in Southern Ontario, some in Quebec, and a few here and there. But I believe, like most other surveillance programs, nothing indicating that they are increasing in abundance, at least not based on the eTick data. Everyone is checking out the longhorn tick. So Haemaphysalis longicornis is something we're watching for. So whenever we get a Haemaphysalis record on eTick, we make a request for the physical specimen, just so we can confirm that it does not belong to Haemaphysalis longicornis. So some of the cool discoveries. So I am a systematist and a taxonomist at heart, so I can't pass the cool things we found this year. So actually, Ixodes ureae, starting to the right here, is something we got from Newfoundland both last year in 2022 and in 2021. It is an interesting tick. It's actually found on both coasts, but so far we only have records out of Newfoundland. Other interesting things, if we stay in BC, we got this spinos ear tick, a single specimen, but again, this was an interesting discovery. It's a soft tick, of course. The original plan for eTick was to really concentrate on the hard ticks, but we figured that, considering we really do not get that many soft ticks, we might as well add them to the list and keep up with those. Then a few interesting, well, 2 specimens of the bad tick, one from Alberta, from Saskatchewan. So I'd say these were the highlights in terms of less common things for the 2022 surveillance here. Of course, there are only a few specimens, but still worth mentioning. A few things about 2021 compared to 2022. So these are the dermacentor submissions. Remember, I said that this is really the group that is the most abundant pretty much across the country. May not be necessarily the same species, but together these dermacentor ticks really make up for the bulk of eTick submissions. And you can see that out east, if we look at Ontario and Nova Scotia especially, even Quebec to a certain extent, you can see that 2021 really was an exceptional year in terms of abundance for that group. And oddly enough, if we move out west, for example, Saskatchewan and Alberta, where there's usually quite a lot of these, well, 2021 wasn't that great of a year. So there was something interesting happening with dermacentor in 2021. Now let's just talk a little bit about Ixodes scapularis. So this species here was definitely, of course, the most abundant in some provinces. For example, here at the bottom, I've provided the relative proportion of Ixodes scapularis or Ixodes pacificus for BC in proportion with the rest of all submissions for the provinces. And you can see that both Quebec, New Brunswick, PEI, and these three provinces really have a much higher proportion of Ixodes scapularis than some of the others. For example, Ontario, which really, again, bears the bulk of our submissions, has, relatively speaking, a lower proportion of Ixodes scapularis in its submissions. Now, I'm really into just the descriptive of the raw data here, so don't read too much into it. But here, it seems that both Ontario, Quebec, and Nova Scotia had fewer submissions for that species in 2020 than they did in 21 and 22. So the last 2 years have been pretty busy for Ixodes scapularis out east. So I just want to talk about, very briefly, let me go back to my previous slide. I want to talk about Alberta very quickly. So Alberta is a province that joined in 2021 and that has been pretty active at promoting eTick. And what we found was a number of Ixodes scapularis that was higher than what we anticipated. So here on this next slide, if you just look, and this is just data a print screen of data that I took this morning. And if you look at Alberta, just for Ixodes scapularis, of course, the bulk is out east. We have some in Manitoba, where we know that there are some established populations, the occasional submission in Saskatchewan, but we're seeing actually more submissions than we originally anticipated from Alberta. One note though, and this is something I did not talk about before, but well, a little bit. Most of the Ixodes scapularis, so that we find in Eastern Canada, usually the hosts are about 50% humans, 50% animals, primarily dogs. In Alberta, I have to underline that about 5% of these submissions were from humans, all the rest from domestic animals, almost, well, primarily dogs. So there's a difference here, and something obviously that will need a bit more investigation, but a pattern that I found interesting, especially compared in contrast with Saskatchewan. If we just look at the first few months of 2023, so literally as of today, we see that we have more submissions of Ixodes scapularis from Edmonton than we have from Winnipeg. And again, none in Saskatchewan. So again, something that may be worth digging into. And I think I'm not the only one looking into this pattern. And I thought it would be an interesting forum for me to communicate that information. So let's just continue here. Moving on from or beyond some of the things that some of the surveillance data that we've accumulated, I want to talk about a few of the other things that we do with eTick. So obviously, one of the important part is for us to collect the data, so to use it for surveillance purposes. But returning information at a time when people most need it, usually right after a bite, is a service that's really important to us. So not only do we make sure that the messages we disseminate are accurate and up to date and easy to understand, we're also working on a variety of other resources to provide information and suggestions and resources for a wide range of different people. So we're using social media. Our Facebook page doesn't have that many followers. We have 1,300, but it is still quite active. And we have managed to develop quite a lot of content. And that content has actually been shared quite a lot. And so we have some of that content that is available for download, posters that can be printed. All of this is available on the website. We have some short clips, short videos, all sorts of different materials that we try to post regularly to keep people informed and actively engaged with the presence of ticks. So these posts have generated quite a lot of return. So people see these posts on social media and then eventually will visit the eTick website and download the application or just submit straight on our website. The post that you're seeing here, this little video, was our most popular. And when you combine both the French and English version, because I haven't mentioned that, but everything on eTick is always produced and accessible in both official languages. That little video reached over 50,000 people. So this is the kind of things that we're also actively working on. When do people watch our stuff? Well, they watch it usually all at the same time. So traffic on our website and activity on the apps and app downloads are certainly not even throughout the year, which explains why every now and then the site crashes. You can see, for example, in 2022, Emily Jenkins, my colleague from University of Saskatchewan, did quite a few interviews. She was in the media, very active in the media, and you can see that every time she gave an interview, we had spikes in interest, visits to the website, some press releases when we launched the app in BC last year. So every year we compile this data to see what was or what were the most important mediatic events that allowed people to know about us and visit both the website or download the apps. So the graphs that you see here is typical. Usually we get most activity in the spring, early summer, mostly when the media start to really care about ticks. And then in the fall, even though we tend to get more submissions globally in the fall, there's a bit less activity. As I was mentioning before, the apps have really been a game changer for us because 60% of all the submissions are made from the apps. And together, we've almost reached 100,000 downloads for the apps. So something that's been a really great improvement for us. I realize that I've already gone 25 minutes in, so I'm going to speed up through the next few sections just because I really want to talk about a few new initiatives. So in 2022, now that the program had been running for a few years, we ran some surveys and asked people about their experience. And what we found is that most of our respondents were female, and most of them over 40. These were the survey respondents, and the survey was sent out by email. So this may explain this is probably not a fair proportion or representativity of all of our users. However, it does match our Facebook demographics quite well. So just a few things here. We're quite happy that out of the more than 600 respondents, 90% of people were quite satisfied with their submission experience, and about 88% were also satisfied with the quality of the information that they received. So we, of course, asked several other questions, and this survey has been informing a few of the changes that we are implementing this year to make navigation smoother for users. I'm going to skip very quickly over the surveys for public health authorities. As I said, we work closely with public health authorities from each province, and their level of engagement varies. Many of them joined in increments, and basically the engagement level is good. It's even getting better with time. BC and Quebec had about 50 and a bit less of their surveillance data coming from eTick. However, the level of engagement, especially from BC, is increasing in the future. So most provinces in the territories are planning on maintaining and increasing their engagement with eTick. And I'm hoping that the engagement with Quebec can be increased over the upcoming years. Okay, so I made it to the new initiatives. A few things, or at least this is information I've never presented anywhere. And I have a lot of things on the boiler. I've already mentioned the Atlantic Hub. So this is initiated, the training has been completed. And so the new partners are working with us so that things can run smoothly. I'm going to talk today about two new initiatives, something called Tick Tool, and then how we're planning on using and integrating AI into the platform. But very briefly, before I do that, now that we have a data set with more than 37,000 data points, we can start asking questions, trying to look for patterns. There's a variety of questions that can be asked at different geographical scales. So we have data that is public, we have some data that is not public, information about the host, different information about the human host as well. So if you are interested in the data for research purposes, please let us know, just contact me, and we can see how the data could be exchanged. So we do that quite a bit. And before I talk about Tick Tool and the development of AI, I also want to talk about some of the other initiatives, and here I've put it in plan, but some of these have been initiated. So eTick can also be used as a way for us to collect certain specimens. So for example, in BC, we have an ongoing project now where we've folded into our eTick workflow the request of some specimens that come from specific areas. We've also had several of these initiatives engaged with different partners. So if you do have a research question that would involve looking at specimens from a specific area, again, you can contact us and we can see if something can be folded into the platform. We're also starting to look into using eTick to recruit participants in a variety of studies, participants in possibly their ticks. So there's a variety of other things we can do with the platform, and we're hoping to ramp up these new initiatives in the future. But now let's talk about the new initiatives and new items that have already been initiated. So let's talk about Tick Tool. And I saw earlier on that Natasha Bowser is here. So this is Tick Tool is an initiative that was developed that it is in development at the Université de Montréal by Cécile Annie-Zenslen, Catherine Bouchard, Natasha Bowser, and Lucie Richard. And it is an interactive and pretty elaborate web content that will be hosted on the eTick platform. So basically a page dedicated entirely to prevention information about ticks, and also that will offer in time some quizzes and surveys to get more information about, for example, prevention strategies, and for people to test their own knowledge. So this is a fairly big addition in terms of content. So the content is being built as we're speaking, and we're hoping to have the actual interface and all the content for section 2, so everything you should know about tick bite prevention, ready for display this fall, and roll out the rest in 2024. So if this is something that you're interested in, I saw that Natasha is here, so you may want to ask questions directly from her, but hopefully you'll hear more about Tick Tool in the months to come. I'm going to close the presentation by talking about AI. So every time I give a presentation about eTick, I get questions about AI. Why are you not using AI to identify your ticks? Everyone's using AI. And I agree that there are quite a lot of great tools that have been published for using AI to discriminate between tick species. However, pretty much all the literature and all the work that has been done in that area involves great pictures, standardized pictures taken always by the same person. eTick is different. The pictures we receive are taken by the public, and even if we provide information on how to take a good picture, well, people don't always listen, or they may not have cameras that are of great quality. So we have a really special data set here that basically we have to deal with less than perfect images. And so this is why we've decided to see how we could integrate a couple of AI tools that are designed specifically for the eTick platform. So the first thing that we're working on here, and by the way, I want to mention my colleague, Etienne Clabeau from University of Sherbrooke. He's been working on these new products with us, and things are looking really good. So one of the first things that we want to implement is to be able to detect and crop the images right in the pre-submission stage. So basically making sure the tick or that the algorithm can see where the tick is and actually crop the images straight away before it is uploaded on the platform for examination by our administrators. So a picture like this, it may look not bad. We know it's a tick. It's good enough to know it's a tick, but I can't do a species level ID on this image. And so because the resolution is very low, the pixel here would be, pixel count would be quite low. We would actually be able to tell people right as they are submitting that their image is of poor quality, and please upload a new one if you want to receive an identification. At the moment, the images are uploaded, and it's not until a member of my team looks at them that they will make a decision as to the quality of the picture, then contact the user saying, please upload new pictures. So this is one of the measures that we want to put in place to improve the flow and improve the quality of images that are actually being processed by our regional administrators. Now, the next thing we want to do is also improve the actual image quality. So even when images are okay, it doesn't mean that they are great. So we have been working on, well, I say we, obviously Dr. Clabeau is the AI person here, but he's basically developed some algorithms to integrate a certain level of super resolution. And so when a picture of the quality that we see on the left could be actually automatically processed to end up the picture that we see on the right. Now, obviously, I can tell it's a dermacentaur just by looking at the image on the left. However, this is a process that can be applied to images of even lesser qualities. So here we have a dermacentaur male, for example, and these images will be then the ones again identified by our administrators. And this improvement in image quality is probably going, well, probably we're hoping is going to result in a higher accuracy level, but also a higher level of image or a higher percentage of images that we can actually identify, because there's always a proportion of images that we can only ID as far as exotidae SPA. So in this case, these this capacity to improve the quality of the images at the source is going to improve our capacity to identify them properly. The last thing that we're working on, and again, this is a first step to see what we can do with AI, is to try and see if we can use it to sort all of the dermacentaur from the other taxa. Now, you're probably wondering, yeah, but why aren't you focusing on Ixodes scapularis? Well, Ixodes scapularis is similar to a lot of other Ixodes specimens. And often it requires a little bit of experience and training in order to discriminate it from, for example, Ixodes muris or some of the similar species. Dermacentaur, on the other hand, is a fairly characteristic group of ticks. And if we had the capacity to have it I wouldn't say ID, because of course we would need to do a lot of quality check here, but sort of fast track towards the dermacentor identification pool, then it would leave a lot more time for our regional administrators to spend time on the other, often a bit harder submissions to identify. Now, this is something I thought was going to be easy, because of course, if you have dermacentor and ixodes, well, it's a slam dunk. Artificial intelligence is actually not that intelligent. It's a bit tricky, but it would be easy if all we had to do were female dermacentor versus female ixodes. That being said, we get a lot of males of dermacentors that we have to process. And, we also get things like the amblyomas, which we totally do not want to miss. So we cannot afford the AI to treat those amblyomas as dermacentor. So it is a bit trickier. The proof of concept is not that hard, but what we want to do is really a proof of application. We really want to see if we can integrate it into our workflow. And one of our priorities is going to make sure that we do not miss the amblyomas, that it does not classify them as dermacentor. And this is what we're working on now. So I'm going to keep those results for later. So I think this kind of covers the new things I wanted to talk about. And before I take questions, I really want to thank all of the people that work with me on this project. I have many different partners, different institutions. Thank you for all of your great work.
Thank you so much, Dr. Savage, for your fantastic presentation. And you did give Dr. Ogden a run for his money with today's presentation. 51 people, 53 if we count you and I as well in the call. Very close to topping him off for his attendance record yesterday. We do have some time to answer questions from the audience. I'm just checking the chat box. I don't see any questions in the chat box, so I will open it up to the audience. If you have a question for Dr. Savage, please raise your hand icon or unmute right now and ask your question. Go ahead, Dr. Bashar.
Thanks, Veronica. Hi, Jade. Super interesting, your presentation. I can see that eTick is, sky is sort of the limit. Related to the burden of identification of the images, how is it for your team? I was curious to see in terms of resource capacity if
It's an interesting question because, remember how I said that different provinces have different profiles. So for example, it's actually harder in Quebec and Ontario because we seem to have a bit more diversity. So especially in the spring, there's a lot more variety. When we move over to Saskatchewan, there's less diversity. So it really varies. So again, Saskatchewan, it's almost just dermacentor. So this is very easy. However, for the same number of ticks in a different province, it would be harder. I would say that personally, I think things are going very well. So we have training that goes on every year. We've had partners for a long time. We do quality control punctually, especially when we have new people. I think things are running very smoothly. The reason why I think taking the dermacentors out would be useful is that it would actually allow our admins to work or concentrate just on the other taxa. But I cannot say that it's a lot of work. Like, to give you an example, during my morning coffee, I can do 20 dermacentors, like in 5 minutes. But one ixodes mirus could take me an hour because I'll have to play with the picture. I'll have to check the record. I'll have to think about it. I may need to ask the user for a new picture. So there really is some submissions will take us 20 seconds to deal with, and some may take an hour. So right now, I think things are running smoothly, and I'm quite happy. So I think the burden is definitely much less than having physical specimens in a lab with all the bureaucracy that comes with, because most of our processes are automated by now.
And in terms of the AI you mentioned with that other person from U Sherbrooke, I guess, I haven't seen, but perhaps I missed it. But are you thinking about AI for image identification as well? Not only like sort of smoothing the
No, that
images
was what I
that
was telling. So basically the
Okay.
first step of using AI is really to sort the dermacentors out.
Okay,
So
okay,
we've
okay.
run, I mean, right now we've gone through about 8 different iteration of models. We've tried 8 or 9 species, the males, the females.
Okay.
It works, but I think what is really, it works most of the time, but that's where
Yeah.
the problem lies. And that is, for example, as I was saying, giving you the example of the amblyomas, because of the, how AI works is that you need to train your models, and they're going to be trained mostly on what we have, which is primarily dermacentor. By default, on 100 image, if it has one amblyoma and makes a mistake, we have 1% of mistakes. Hurrah, we're right 99% of the time. But that 1% is the one mistake I do not want to make. So
Exactly.
that's why we are progressing very, very
Okay, cautiously.
cautiously. So as I said, it's not a proof of concept. It's really, we're looking at a tool that we can integrate into our platform to make sure we don't make mistakes where they count the most.
Yeah, thank you. And sorry, I missed that.
Well, that's fine.
No problem.
Thank you to Dr. Bouchard for your question. Dr. Colati, I'm going to go to you next, and then I'll go to the questions in the chat box.
Great. Thanks for the presentation, Jade. That was really exciting work. Obviously, a fantastic data set. So I'm curious about the ticks themselves, because that also seems like a fantastic resource for not only for finding new species, but also, potentially looking at population genetics or microbiome variation. So have you got something going on that end, or have you thought about that at all?
Yes, well, we got loads of things. So right now I got my hands full managing this. So what I've been doing, so as I said, I'm a systematist. I get excited by the new things, and we do make requests primarily at this point to build up our reference collection and to make sure that we have good representatives of everything, including some of the trickier species. We have, as I said, a project going on in BC where we've folded into an automated request for some of the material. So there's a project going on there. Anyone that would like to set up something just needs to talk to us, and we can actually make the requests for the specimens. So right now we have an automated button that says, please send us your specimen, and we explain why, but there's ways for us to fold in automated requests that are tailored to the need of a specific project. And that is absolutely possible. And that's what we want in the future, because it's such an easy way to collect specimens from either humans, animal, a restricted geographical area, broader geographical area in a specific period of time. So it's quite easy for us to do that. And that's why in one of my slides, I was encouraging people to contact us. If you have a project in mind and you think eTick could be a facilitator, we're always open to these new collaborations.
Great, thanks. I'll send you an email.
Thank you, Dr. Colati. Okay, Dr. Savage, this is the first question in the chat box. Great presentation. Thank you. Wondering if you and the team have analyzed how the citizen surveillance data lines up with the Sentinel surveillance network data.
I had a talk with Patrick a few weeks back. It's our next step. I think, remember how I was saying that the eTick data the data set has been building up slowly. So for example, Quebec has 6 years of data, but the Yukon has 1.5. So not the data set is not equally mature. So we have provinces where now we do have what I would call a relatively mature data set, especially Quebec, Ontario, as well as New Brunswick, Nova Scotia also. And so we are starting to see, asking these questions. So that's the next step to see how they align. Also, how they align with some of the other surveillance programs that have been going on. So Natasha Bowser, who's here, did use some of the earlier data from eTick to inform some of her work. So we are looking into all of this, how to integrate the eTick data with all of the other great initiatives out there and see how they talk to each other and how they reflect each other.
Thank you. Our next question in the chat box is, hello, a very interesting presentation. Thank you. Is this linked to other public health projects? For example, for ticks that carry disease, when photos are submitted, do you ask if the submitter has been bitten? Do you provide them with any information on treatment? And is there any follow-up on their health outcomes?
Okay, so the one thing that makes us capable of doing what we do is that we are a tick monitoring platform. So we can collaborate with others. So for example, in Alberta, the Alberta lab has actually set up something whereby when we identify a tick, we have in our messages a link where people can go onto the Alberta website, and there is a service for them to send their tick and get it further tested. But that is dissociated from what we do. So getting into human data, especially health data, is a really different type of research. And so we've tried to remain flexible and agile in what we do. We've tried to really focus on the ticks and make sure we collaborate with others in terms of health questions, but that these are done separately so that we can respect all of the ethical requirements for these other projects. But coming back to what we do, of course, we ask a question as, was the tick attached or not? So this is important to a certain level for people to know if, well, not necessarily the consequences, but just for them to realize if the tick was attached or not. In the messages we disseminate, we do have information about the relevance, medical relevance, possibly some symptoms. Again, these messages are drafted with the provinces, and we communicate as much or as little as they want us to. And we improve and modify the messages. So yes, we provide information of medical relevance, but we do not gather any data related to health or any data related to long-term monitoring of the health of the people that use the platform. These are projects I hope can develop in collaboration with us, but also separately from us.
Thank you. There's a comment in the chat box. Great work to develop this database. It will be important to utilize as we correlate with human disease surveillance. Thank you for the presentation and great use of the AI to facilitate that program. So that leads on to what you said of partnering with other researchers on the clinical side of things and using eTick as a tool to, with their projects as well. Another question, thanks for the presentation. Do you have some proportions to do you have some propositions to export eTick to other countries, for instance, in the United States or European countries?
No, no. Obviously, if some people are, well, first off, in the US, there's Tick Encounter. That's already an interesting resource. There are a variety of other platforms that exist for Europe. I believe France has its own. But I think eTick is really a Canadian initiative, and it works because I can manage it. So of course, Jérémy Bouffard, who's here, is my project manager, but it's a project and a platform that I'm capable of managing while, doing the rest of my job, which is being a university professor. I think that if it were exported or expanded, the risk of diluting the product would be very high. However, this is non-commercial. I never want this to become a commercial venture. So if anybody is interested in using it as a model to expand or develop something similar outside of Canada, we'd be willing to collaborate for sure. But I do not, I think it was really something planned for Canada. And I think this is where the expertise that we have and the collaborators that we have lie, and that's why it works. Opening it, especially because the US has a different fauna, just, the ramping up to making it efficient would be too much, at least for me.
Thank you, Dr. Savage. Okay, looking at the time, we probably have time for one or two additional questions. If you do have a question, please raise your hand icon. I'm just checking the chat box as I scan the attendees. Okay, last chance, one last question. Going once, twice. Okay, well, I do want to personally thank you, Dr. Savage, for your presentation today. I know you were representing your research team across this country, and I do want to thank you for this insightful presentation, and thank you to the audience for all your fantastic questions. Lots of thank yous coming out in the chat box. Before everybody signs off, I just wanted to remind you of our upcoming presentations. We do continue the rest of this week. We still have presentations on Wednesday, Thursday, and Friday. Our next presentation tomorrow is Dr. Carissa Doherty, who will be presenting on the topic why Lyme patients use naturopathic medicine. So we hope you can attend. Her presentation is 1 p.m. Eastern Time tomorrow, May the 10th. Also, a reminder to help take part in our challenge, Wear Green, take a photo and share it with us to help spread awareness of Lyme disease and tick-borne diseases. You can send your photos in also of your creative work. If you're an artist out there and have done pottery or drawings or sketches, and you've got anything that express Lyme disease or tick-borne disease awareness events, send your photos in. All photos entered would automatically be entered into our draw for one of 4 $25 Starbucks e-gift cards. And our live draw will occur on May 31st at 1 o'clock, which is our last day of our presentations. And send your photos on to clydron@gmail.com. And just a reminder, we are going to be hosting our first scientific symposium in person for TickNet Canada in Toronto, Ontario, October 24th and 25th. We hope to have registration and abstract submission opening up in the coming weeks. So stay tuned for more details. If you are part of our distribution list, you will get more information about the symposium as well. Again, thank you, Dr. Savage, and your research team for today's presentations. Thanks to the audience for joining us today, and we hope to catch you the rest of the week. Have a great rest of your day.
Bye.